Om Shanti. Can you hear me?
Yes, ma'am, I can hear you.
Let's start the session. Come into the sitting position. Keep your back, neck straight, aligned. Relax your body. Gently close your eyes. Go into your posture. Bring the awareness towards your breath. How the breath going in and coming out. Now take a deep, prolonged, slow inhalation. Deep, prolonged, slow exhalation. Inhale and exhale. Now inhale for the Om. Take a deep breath. Om. 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 Shanti. 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 Feel the vibration and sensation. Join your both palms. Relax your tongue. Place on your eyes. Very slowly while blinking. Looking at your palm, gently open up your eyes with a great smile. Ram Shanti. So, till now we discussed about the Ayurveda and what causes the disease, and through the Mitahar, what general diet, through the general diet, how we can control our the imbalance of the three dosha and imbalance of the Agni, and how we can stop the disease in the Ama, and we understand these procedures, right? Now, from today, we're gonna start the yoga therapy. The therapy, yoga therapy, which is, based on the mix fusion of the Ayurveda, Unani medicine, asana, pranayama, uh, the meditation part, everything would be included. Yoga therapy is basically the yoga and the Ayurveda fused together. We are looking, and now in modern time, we actually include everything, uh, especially the natural way of healing the human body and the mind. We are taking help from everything, Unani medicine, or rather is a homeopathic medicine, or anything, whatever naturopathy, or these other alternative method we can apply in order to heal ourselves. Okay, so This yoga therapy, a little bit, I'll talk about it. It started from the 18th century onward, and in the France, the coinage of the yoga therapy is happening in the France by the French doctor, Doctor Bernard Oriel, or nothing is named, but this coinage because in the France they are doing the research over the psychosomatic problems and um, the psychological problems. So they find out that when they are introducing the meditation to the patient, it's really helpful. It's helpful for them, those who are practicing the meditation and those who are not. So then they start using it, and then they give the coinage yoga therapy. But in India, yoga therapy is like we didn't give the name, but like Hatha Yoga we are using, Ayurveda we are using. We use the many method to heal ourselves with the help of the nature, right? So there's no names in our culture, in our in India, but the thing is that we are using the natural way to heal ourselves since generation to generation, which your mom knows, like your mom is half of the doctor. She knows how to treat um, her kids. She knows what kind of how much turmeric and what kind of food should be given when her kids are sick, right? So your mom even know about it. My mom even know about it. These things it passes generation to generation, mouth to mouth. Okay, but yes, this come in acknowledgement when out European countries start doing the research over this yoga, and then they use as a yoga as a treatment, and then it's come you they give the name yoga therapy. Okay, so there's a many aspect in the yoga therapy, but the three aspect of the yoga therapy which we have to include: one, the yoga, uh, who can practice the yoga therapy. Yoga therapy can be practiced by everyone. So three part we can understand that who can practice. So one is yoga therapy can be utilized by the people. One, it can be used as a yoga chikitsa. Okay, chikitsa karma. So chikitsa karma first. Second is chikitsa karma. Okay, write it down. I'll write it down for you. So yoga therapy, three things you should know that who can practice. First is chikit, shakti, third, then adhyatma, So yoga therapy used for the three purpose: Chikitsa karma, Shakti karma, Adhyatma karma. Chikitsa karma means basically for treatment. When you are looking for the treatment, you get certain kind of problems. So Chikitsa use as a for treatment, okay, and prevention. Cure, treatment, and prevention. Okay, it's coming to the Chikitsa karma. Shakti karma is like to strengthen. You are fit, you don't have any issue, mental, physical, but still you can, apply the yoga therapy and you can practice in order to strengthen your power, muscular power, bone power, your skeleton power. You want to improve your flexibility or anything, whatever you want to improve, right? That Shakti means strength, to improve your strength. Then third is Adhyatma karma. Adhyatma or Adhyatmic means for spirituality. Even for spirituality, you can start practicing the yoga therapy because yoga therapy include everything. So for going on the spiritual path, if you doesn't look for the treatment or a prevention or even not doesn't want to strength, but you are want to attain the enlightenment, then yoga therapy is for you for the basic level. How you gonna start? For basic level, you have to clean yourself. So Shat Karma you're gonna practice. Then you have to practice the asana, then little bit the breathing practice and the pranayam. Then slowly, gradually, you move towards the higher goal of the yoga. So Adhyatma Karma on the basic, you can start with the yoga therapy, which fulfilling these three aspects. Okay, so Chikitsa Karma, Shakti Karma, Adhyatma Karma. Now let's talk about the problem. Now our focus on the Chikitsa Karma. We're gonna talk about how through the yoga therapy we can provide the treatment. So I'll give you the basic general guidance. I don't think about the specific, problem related treatment because there's a many other things we have to consider, which I'm not going to explaining to you because you require the deeper, more experience in this field. Okay, but the general how you can generally you can help yourself and other people when certain kind of problems they are facing or certain symptoms they are facing it. So generally how we can help them. Okay, not specific treatment we're gonna talk about it, but generally or the safe one, which you don't require much deeper understanding about the yoga technique. Okay, so let's start with the problems. Today, problem which we're gonna discuss about that is the skeleton bones related problems. Okay, so what happened when your bones are affected and there's names certain problems like arthritis. Uh, so arthritis, we can start. So if I'm gonna show you the picture, other bones related problems like arthritis, osteoporosis, okay, and then back related problems. Your you have disc herniation problems. Your disc is bulge out. Anything which is related to the skeleton, your skeletal system, skeletal muscular system. So what we can do about it? How we can help? You know, uh, certain through the diet, certain through and the asking how we can help them. Okay, those we gonna talk about it. So what happened in arthritis? I'll show you the picture to you to give you the better understanding. Just a moment. So see the arthritis. So basically, this is the you have in your body. You have more than 100 types of the arthritis. But we're gonna talk about the two kinds of rheumatoid arthritis and osteoarthritis. Okay, these are the very common arthritis. We have many types of arthritis, but these are the very common arthritis. Okay, osteoarthritis and rheumatoid arthritis. Okay, so then later on we're gonna talk about so arthritis is what like inflammation of your joints, synovial joints. So you know these are your synovial joints. If you did the anatomy class, synovial joints, like whatever movement in your body is happening, it's happening because of the synovial joints. So your shoulder, your ankle, your wrist, your fingers, everything is these are the synovial joints. So in arthritis, osteoarthritis, something happened because of some bacteria is invading your body and they attack to your joint, and then your joints get inflamed. Okay, but in rheumatoid arthritis, what happened? Inflammation happened in your joints, but because of your because it is autoimmune disease. What do you mean by the autoimmune disease? Understand any infect like even you get the mosquito bite, no, small mosquito bite, if you get it and there is a redness, that is must it means your immune system is fighting with that mosquito bite. So whatever going on in your body, itching or some bites are happening to you, some wounds are, or some insects are bite to you, and then you see the inflammation redness around that part. That's because of the because immune system is the white blood cells are fighting against that invasion of the bacteria or that bite. Okay, because in their saliva, in the insect saliva, there are many bacteria which transplanted into your skin. Okay, so your system is fighting. But what happened because of uh, something wrong happened, your cells, your soldiers, white blood cells forget about to get the difference between the right cells and the wrong cells. It's like outside invasion and the inside. So they start attacking your inside cell. It's like, for example, you have the army of the soldier, and on the border, they get the signal that somebody is invading, but there is no invasion happen. And instead of they have to, their duty is to kill the invader. They start killing their own soldier, and then that's you feel the inflammation, and because of their chaos in that the borderline, so there's a tension, and then it heat up, and then you feel the inflammation. So your white blood cells start affecting your own body cells, and then you feel the inflammation. Your joints are affected. So rheumatoid arthritis, there is no cure, permanent cure, but we can reduce the symptoms through the yoga therapy. Okay, and even the allopathic, they provide the pills, they provide the drugs for reducing anti-inflammatory drugs in order to reduce the inflammation of the joints. But again, as you know, that anti-inflammatory and these kind of tablets gonna harm your kidneys, liver if you're taking for the longer period of time. So you cannot, and there's no cure for it. So everything you have to do by naturally. Okay. So these are the very common problems. Either you get the infection or you get the autoimmune disease. Uh, Both symptoms, you have to control your diet. You have to basically change your whole lifestyle. So if you prolong this, maintain this moderation of living your life, like you're maintaining everything, balancing, everything. So maybe you can cure your problems. Okay. So the symptoms of the arthritis, basically morning stiffness in the joints. If it's remained for 1 hour, it means you have to go for the test. Warm and tender joints, pain, swelling, range of motion if it's affected, and deformation in the joints. And later on, you feel the effect. Your lungs would be affected if it's prolonged for the longer time without detection. If you're not diagnosed early, then it can affect your lungs. So even your eyes, you feel the itching, skin, uh, like there is sensation in your skin, like needle kind of sensation you feel, tingling, you get the insomnia, and slowly, gradually, all organs would be gonna affect. So now come to the so this is all about the problem. So you can see your joints become ruptured permanently. If you see this joint, it's healthy joints, but if it's inflamed, it's become red. Okay, so these joints are inflamed. The synovial joints gonna inflamed, and then it's gonna rupture permanently, degenerated cartilage. It's somehow it's in synovial joints you have the cartilage, articular cartilage, then membrane and synovial fluid. Everything would be affected, and then later on your ligaments gonna weaken, your tendons gonna weaken around that area, and then people get deformed hands, and it started with your fingers first, and then later on spread into the entire rest of the synovial joints. Clear? This much you understood? Now come, let's talk about the treatment. Okay. So, treatment, what kind of treatment we can give to them? So, let's talk about the diet first. Understand, maybe in your family, their knee would be affected, ankle joint would be affected, wrist joint would be affected, all kind of joints can be affected, and it's very, very difficult for them to do the normal day-to-day activity. Okay. Only things they can do about it, if you are taking the allopathic treatment, again along with that you can do the yoga therapy also. Okay, there is no harm. So if you don't want to skip the allopathic treatment, that's okay, keep continue, but along with that you can follow these yoga therapy treatment as well. So now the diet for the arthritis and the rest of the problems. Okay, other problems, osteoporosis and other things. And in osteoporosis, basically what happened? It's happened because of the um, age. Here the age factor is count, because as you go old, as you're growing the, entering into the old age, your body, your bones start thinning down. Okay, so it's like because of the degeneration of the cells. Instead of regeneration of the cell which is happening in your body, you start when you enter into the old age, your regeneration of the cells start happening. Okay, and then the thickness of the bone reduce to the become the thin. Okay, slowly and gradually. How when you enter into the old age, and it's depend on the what kind of lifestyle you are following it. So, example like many yoga instructor and the yogis, they are very flexible in their 60s and 70s. So they delay their bone degeneration of the bone. So they're working on the strengthening their bones. So, and by opting the good lifestyle, they can control degeneration, and then they can delay their old age. So osteoporosis is very common, and it comes with the old age. When you enter into the old age, it's totally depend on you. You can go early or you can delay it. It's totally in your hand. Okay. So it's not like after 20, even 20 years old people are also getting into it because their degeneration process is happening very soon to them because of their bad lifestyle, right? So, but if you increase, if you do the good practice, you never end, even you not even enter into the your 60s also. So, totally depend on you. So now treatment, if you get these kind of problems, osteoporosis or any kind of like back issues, disc herniation problem, disc herniation when your disc is bulge out in your spinal cord, you have the disc, uh, which I'm gonna show you, which degenerated. Okay, in disc herniated, what happened? I'll just show you the picture. The picture is visible you. These are the mostly problems of your spine, disc related issues, normal disc, degenerated disc, and then bulging disc, then herniated disc, thinning disc, and then disc with degeneration with the osteophyte formation. Okay, so these are the types of the problems of related to the disc problem. So you can see the herniated disc. These all the problems we're gonna talk like we're gonna talk about that how we can provide the treatment to these all the problems. No matter what kind of problem you are having it, so you can see this part that disc is bulge out. Okay, one air area where disc is osteophyte. It means your bones is also affected. You can see this area to compare this with this. Your bones is also degenerating, start degenerating with the disc degeneration. Okay, but here only disc is degenerating. This is the difference only. When this disc is become little bit thin, that called thinning of the disc. What is the function of the disc basically? It provides the cushion between the two joints. So there is a joint. You can see one bone's vertebrae. This is called vertebrae, right? This is called vertebrae. Vertebrae. V. Okay. So these two vertebrae are joined together. We require certain kind of pillow in between the cushion. So when you jump, when you walk, when you do the running, what is the shock is given to your spine that gonna absorb by the disc. And because of your wrong lifestyle, wrong posture, your disc would be affected and your vertebrae also gonna be affected. So by opting the good lifestyle, you can regenerate. You can start instead of degeneration, it can be a regeneration also. It can be possible. How it's gonna be possible? We're gonna talk about it. Okay. So I hope you understand. I'm not going to give you the detailed information, but you get the little bit idea about it, what happened in the osteoporosis, disc disc-herniated problems or degenerated problems or thinning, and the arthritis. Okay, and back-related. So these all the problems gonna affect your back-related issues also, back problems. Uh, why you are having the back related issues? It could be a related to your disc, your bones, your maybe you get the osteoporosis or arthritis, or maybe your disc is bulge out. Any kind of problem you would be having, and because of the wrong posture, also wrong pressure on your back, and Even sometimes it's happen like nothing is happening to your body. Everything is fine. Your spine is fine. Everything is properly fine. But because of because of your psychosomatic, you take so much stress that's also trigger the pain in your certain area, the area which is weaker. Okay, so these kind of psychosomatic pains is also nowadays the research is finding out everything system is working perfectly. Your skeletal system, your muscular system, everything is fine, but still psychosomatic problems are coming to your body. Psychological, because of that, you feel the pain in your physical body. So, what kind of procedure we can do? What kind of treatment? So, today we're gonna talk about the diet. Write it down the diet for all these problems. Um, I'll be specific when there's a little bit symptoms. So first we start with the arthritis diet, and that can be followed by the rest of the people also. Okay. So arthritis, in that everything become cold in nature. So we have to give them the warm food. Okay. So all the grains are cold in nature. Okay. When they eat, they get more cold to their people, right? Like for example, wheat you are having, rice you are having, they are cold in nature. जिसको बोलते हैं बादी, right? In Hindi we call it badi. So how you can eat them? So wheat, oats, rice shouldn't be taken by them. It increases the vat in their body, vayu, and these all the problems are related to the vat related issues. Mostly skeleton problems are related to the vat. Okay, so vat is increased by the all most of the grains like wheat, oats, rice, okay, white rice. So instead of that, they can go with the millets, all varieties of the millets, gram flour like chana, um, chick chick flour they can take it, or gram flour they can take it. Okay, with adding the garlic and ginger and turmeric and ajwain spices, and then they can add the cloves and then they can add the chapati. Okay, so if you're taking the wheat also, you cannot, like you are traveling and you cannot get anything. So if you are taking the wheats, at least add these things. Garlic
Ma'am, your
and
voice is breaking.
spices, even you can add two or three, depend on it.
Ma'am, your voice is breaking.
Kritanjali, it's better now.
Yes, ma'am, better.
Okay. So I was talking about that instead of having the wheat oats rice, you can have the millets, gram flour, besan जिसको बोलते हैं. Then you can have the wheat flour. Then ragi you can have, and by adding turmeric, ajwain, and garlic and ginger into that, you can make the chapati of it, and you can have those things. Okay, and then fruits, citrus, all kind of citrus food should be avoided. Okay, because unripened fruits also be avoided completely. And if they are having the fruits, there's a specific fruits should be given to them. Papaya, ripened one; pineapple, ripened one; chiku, mango, banana, ripened one. And you can add again the spices, ginger powder, the raw ginger powder, raw cumin, roasted cumin powder, okay, and rock salt. These spices you can add when you are having the fruits, not like just you cannot have the banana like that. So you have to add these spices on the top, and then you can enjoy. One or two fruits you can take it, or you can make the salad out of fruit salad. Or but don't try to mix match so many things. Try to take the, like, one day you can have papaya, second day pineapple, third day chiku, then mango, then banana, like this. And try to have the seasonal fruits in them. Like if there is a banana time, take the banana, mango time, take the banana, like this. In vegetables, green leafy vegetables should be given to them. They can have the soups and other things. But if they have the pain of arthritis, completely avoid. Okay, and do not give the store vegetables which is in the store in the fridge. Anything which is stored in the fridge should not be taken by them. They can have the fresh fruits, fresh vegetables, seasonal vegetables, seasonal fruits, but rest of the things which is stored for the prolonged time into the fridge, and in order to increase their shelf life, that gonna increase their vat, and vat is increased, so their arthritis attack gonna be increased. So strictly fruits and vegetables which are stored in the fridge for longer period of time shouldn't be given to them. Salad, they cannot have the raw salad, but onion, garlic, ginger salad they can have it. Okay, raw. Rest of the salad they cannot have. Okay, raw, other salads like cucumber, these things should not be given. So they can have onion, garlic, and ginger salad only. And by adding the few lemon drops, uh, and then other spices, raw roasted cumin powder, rock salt, you can add it according to your taste. Then moong dal is best for them. Instead of having the other pulses, green pulse is best. Okay, adding with the ginger, okay, with the moong dal, with the skin should be given to them with the skin. And not using the pressure cooker for the cooking, use the handi or the clay pot or the iron pot for cooking the moong dal. With the open lid, you have to prepare, and then you can add the spices, same spices which I am using it, turmeric, little bit ajwain, garlic, ginger. These spices you can add. Then they should have more cow milk. And cow milk should be given to them with the dry fruits, adding almonds, walnuts, pumpkin seed. These things should be given to them, soaked under the milk, and then before sleep, they can drink that milk by chewing that dry fruits. Okay, those things should be given to them during the night time. Milk and the dry fruits before they are going for sleep. So next, they have to keep changing their oil. They should avoid the coconut oil. Best oil is for them the mustard oil they can have, and or also cow ghee. Fresh local cow A2 level happy cow ghee should be given to them. They should avoid the buffalo products, and massage is very good before sleep and even in the morning. Two times they have to take the massage, morning and evening. Okay, they have to take the sun bath morning and evening. Morning time 30 minutes when sun is rising, and when sun is setting. And during that time they can have do the massage to themselves. Okay, with sesame oil, almond, or also almond oil or the castor oil. These three types of oil they can use for massage. Baked potato, roasted potato can be given to them, but not on the oven. Electric cooking food equipment should not be used for cooking at all. Okay, then little bit hing can be used, asafoetida can be used. Then other spices, ajwain, methi, dana, these can be added in their diet. I don't know what we call methi in English, so you can later Google on. Methi is METHI, methi. Okay, so then early morning aloe vera should be given with the little bit adding the pinch of turmeric with the warm water. They can take it empty stomach. This is very helpful for them for reducing the inflammation of their joints. Then they always should take the bath with the salt, lukewarm water. By adding the salt into that, they should take the bath. After taking the sun bath and the massage, take the rest of 30 minutes and then they go for the bath. Don't sleep in the daytime. Avoid the sleeping in the daytime, and strictly boycott tomato, oranges, amchur, anything which is made of dry mango, curry, rajma, heavy things which is very difficult for digestion. Non-veg strictly avoided because non-veg take more time for digestion. These things all about the diet. Okay. And tomorrow we're gonna more talk about it. Time, we don't have much time, so tomorrow further we're gonna talk about the rest of the things. So this much you understood, which just talked about it. Any doubt till here?
Yes, ma'am.
This much is clear, right? So don't worry. If you have
Yes.
question, wait for the tomorrow session. I'll cover up all the question after completing the all the problems related to the bone radiation. Okay.
Ma'am, when we are wrapping up the course of this
On
Ayurveda,
26th, before 26th.
before, like how much syllabus is left now?
Not much. We are just talking about the disease, and I think three, four
Okay.
classes we're gonna wrap up because we are going according to the general points, not specific points, which gonna help you. So, like today we covered the bone related issues. Tomorrow we're gonna cover the diets and everything. Then later on we're gonna cover about the kapha related problems and other things. I think 4 days more. 3 days mostly. Three.
Okay. Ma'am, do we cover the
You want
majority of these subjects in the 300-hour course? Like totally, thoroughly?
uh, what you asking about it?
I'm asking is when we'll cover the thoroughly subject na kab padenge, like one by one
पूरा
specific disease something, a specific
नहीं
food
नहीं
for
नहीं
something.
specific disease. You are going through the specific disease, it cannot be possible because specific disease we require the deeper understanding. Like if I was going to talk about the arthritis itself, it will take the 10 days even to talk about everything. So we are talking about how what happened when Vata is going balance, what kind of disease happen, and rest of the things. One by one disease we cannot cover because it will take so much time. Then it cannot be possible to finish in the 1 month.
Ma'am,
Okay,
can you
we
suggest some
require
book where I
more.
can go through it?
The uh, for Ayurveda and yoga therapy, there's no specific books are available, but there's a many writers. You can Google it. I'll share you the link. I have shared the one book on Ashtanga Hridayam, which is talking about the Ayurveda.
Yes, yes.
I'll share you the one book which talked about the herbal medicine. Okay.
Okay.
But again, those are not very helpful because these things should be learned under the guidance of the guru. You cannot learn by reading it at all. It's yeah, too difficult because one thing is working on the one and another is not working. So that's the therapy. Okay. So it's required really, really, years and years practice. I learned so many things around going to the many people and learn these things from with many gurus. So so I'm just sharing you the general ideas about it, what you can do about
Okay, ma'am.
it. Okay, so we don't have that much time that we just focus on the one particular type of, and even you don't require it. Believe me, you cannot be become yoga therapist even 2 or 3 months or even in the 1 month or 1 year even. you require many years to become. It required the experience and the more practice. And even still, I'm practicing and experiencing and experimenting on myself. So it's lifelong procedure. Okay, it will take more time. Okay,
Okay, ma'am.
Siddharthi.
Thank you.
Bye bye. Take care. Om Shanti. Mangalam.
Om
Bye.
Shanti.